Hello, I'm Senator Camera Bartolotta. Thank you for joining us. A healthcare crisis is brewing, a crisis that is limiting access to basic quality healthcare, which all patients need. Making matters worse is the fact that many physicians are not accepting new patients and even turning away existing patients. Likewise, there are not enough doctors willing to practice in smaller communities. And as older doctors retire, fewer new doctors are coming in to replace them. But there is a solution that holds the promise of easing this looming healthcare crisis. Pennsylvania is home to an army of qualified, knowledgeable, and experienced advanced practice registered nurses, or APRNs, who stand ready to answer the challenge. Unfortunately, current law places far too many restrictions on their ability to help patients. Joining me in the studio to talk about legislation I've sponsored that would allow nurse practitioners to expand access to care for patients is Dr. Lorraine Bock, President of the Pennsylvania Coalition of Nurse Practitioners, and Lieutenant Commander Dennis MacDougall, a retired veteran of the United States Navy and a nurse practitioner. But before we begin our discussion, let's take a look at a recent nurse practitioners rally right here in the state capitol.
It's a very exciting day for us. Pennsylvania is ready to cut the red tape that separates patients from providers. We all know that healthcare politics can be very contentious. It is so rare that you have an issue where we unite Democrats and Republicans, rural communities with urban communities, young families with seniors, taxpayer advocates with progressives, and hospitals, providers, and patients all together. But that is exactly what we are doing here today. 22 states have adopted this reform to make healthcare better, more accessible, and more affordable for everyone. Pennsylvania can be next. Senate Bill 25 and House Bill 100 are proven to improve health care. As a result, almost every single stakeholder supports the reform. Last session, similar legislation passed the Senate by an overwhelming 41-9 margin. This session, I hope to have even more support.
We need to explore every option to expand access to good quality health care. Fortunately, Pennsylvania is home to an army of qualified, knowledgeable, and experienced advanced practice registered nurses, or APRNs, who stand ready to answer this challenge. Studies have proven that APRNs are perfectly suited to meet the growing demand for services in rural areas, but current law places far too many restrictions on their ability to help patients. That's why I'm sponsoring a bill to provide full practice authority for APRNs and allow them to serve patients to the fullest extent of their knowledge, training, and education.
We're back, and so Dr. Lorraine, as president of the coalition, can you provide an overview for our viewers as to the mission of your statewide organization and the current number of certified nurse practitioners and how they assist patients in the healthcare field now?
Well, the mission of the Nurse Practitioner Association in Pennsylvania, the Pennsylvania Coalition, is to protect and promote the practice of the nurse practitioners in Pennsylvania and increase our ability to care for patients throughout the Commonwealth. Currently, we have well over 11,000 nurse practitioners in Pennsylvania, and the Coalition is the only nurse practitioner organization representing them here. Our ability to care for patients spans across many fields. We have nurse practitioners in mental health who are doing therapy and counseling, prescribing medications, and managing complex mental health patients so that they don't require hospitalizations, and helping them when they do. We have nurse practitioners who are working with our most vulnerable population in the neonatal intensive care units. We have nurse practitioners who treat pediatric patients both in and out of the hospital. Nurse practitioners who specialize in women's health, who are delivering care to patients who have a myriad of physical problems related to women's health, and doing routine care, which can help us prevent patients from getting serious medical problems. And then we have our nurse practitioners in family care, primary care, and in acute care, which are the bulk of the nurse practitioners in the Commonwealth, caring for patients both in and out of the hospital, providing both acute care treatment, chronic illness management, and wellness prevention, things like physicals and things like that.
That's great. And from what I've read and I understand too, that many nurse practitioners stay and practice in the communities where they grew up, where they've lived for a long time, and they know their neighbors and friends, and their kids go to school with them. And have you noticed that to be
Yes,
the fact?
that is absolutely true. Nurse practitioners tend to go back home to practice once they've completed their education, if they leave the area to go to school. Myself included. I grew up here. I've lived here my whole entire life. Went to school in Philadelphia and Pittsburgh and returned here to practice.
Wonderful. Lieutenant Commander, first, I'm going to thank you so very much for your commitment and your sacrifice for our country. Thank you very, very much.
It was my honor.
Thank you. My son is now at Marine Boot Camp in Parris Island as we speak.
Awesome. Semper Fi.
Yeah. Thank you. But talk to us a little bit about your military background and how it has helped you as a nurse practitioner. And after 27 years in the Navy, you wanted to start practice right here in Pennsylvania. How did the current state law pose a challenge to you when you began your practice as a nurse practitioner?
Shortly after retiring, I moved to Pennsylvania. I saw there was a need for access to care. As an emergency department nurse practitioner, I saw that there was just so many folks that just needed to get access for even acute or minor illnesses and injuries. And I started to look at opening up an urgent care with nurse practitioner staffing. Unfortunately, I didn't know any physicians here in Pennsylvania. For a while, I was searching for one. One I did find, and when I presented to him my plan to provide care at only $60 a visit, which was much less than the current urgent care costs, he told me, you can't charge that less of a price. CMS sets the pricing for care, and also he wasn't quite sure. And so it took me over 10 years to find physicians that were willing to work with me based on me working alongside them as a colleague, and then being ready to support me in opening a business.
So let's clarify for our viewers what you mean by you had to find a physician to work with. Currently, the law in Pennsylvania states that nurse practitioners must have a collaborative agreement with 2 physicians. Can you explain a little bit what that means?
Absolutely. And initially, when I first moved here, there was only one. And then shortly thereafter, I must have missed it, but then there became 2. There had to be a primary, and then there had to be a secondary one, just in case you couldn't get in touch with the senior or primary physician. So that, it was kind of ridiculous because finding those folks was extremely difficult, number one. Number two, the law is so obscure that to me it seemed ridiculous that my methodology to get in touch with a collaborating physician would be to either call them, fax them, or email. And that certainly doesn't appear to me to be a prompt way that indicate there's a safety issue and any need for a collaborating physician.
So maybe you can expand on that for our viewers and explain a little bit more what the long-term collaborative agreement with the physicians is and how that creates a barrier, particularly in the rural areas. And now with fewer and fewer physicians taking on more patients and many more retiring. So can you speak to those obstacles in rural areas too?
Absolutely. The collaborative agreement is a business agreement between a nurse practitioner and a physician that delineates that he will be available should there be a concern that a nurse practitioner need to discuss with a physician. Those agreements have to be filed for prescriptive authority, meaning so that we can write for medications with the State Board of Nursing. And they are approved by the State Board of Nursing. There's a simple form that you fill out. It's literally check boxes. In that requirement, there are very few, very specific details about what that physician is to do. He has to be available, as Dennis said. And my concern with that availability is with email and text messaging and what have you, then we violate HIPAA because those things aren't HIPAA compliant. So there's an issue there with the way that you contact them if they're not available by telephone where you can speak to them personally. Even with fax, that becomes a concern, patient privacy. And then it spells out that you must have an emergency plan in your office for dealing with any kind of a medical emergency. And having worked in medical offices for the last 20 years, we deal with medical emergencies by dialing 911 because we don't have usually the necessary equipment to manage something like a complex cardiac issue or what have you. So that seems sort of silly to me too. And the third issue is to intermittently, and that is not defined, review cases with the physician. But there's nothing about how that has to be done, what has to be reviewed, if you're looking at prescriptions, if you're looking at care, what have you. And then most physicians charge a fee for the collaboration. And I can give you an example from literally last week. I have a colleague who is a mental health nurse practitioner. We all know that there's a mental health crisis in Pennsylvania. We do not have enough practitioners. She has a practice that she's had for well over 15 years, and her collaborating physician is retiring. And her backup physician is not interested in being her primary and taking that responsibility. So she called me saying, I've been looking for 3 months. I know he's retiring at the end of the year. Please help me find a collaborating physician.
Oh, my. That's difficult.
500 patients on a panel who are going to be discharged into the community. There is no psychiatrist available to take care of them unless she finds a collaborating physician. And she has literally reached out to every psychiatrist in her community and asked them personally. And one of two things happens. Either they don't want to do it because they don't understand their responsibility, or they work for a health system, Geisinger, University of Pennsylvania, one of those health systems, who prohibits any of their employee physicians from collaborating outside the network. So she's got her own independent practice.
Right.
She has been taking care of these patients for many years.
And they trust her.
And they
depend on
trust her.
Right.
And she knows them. And, you know, she has a great rapport with the community. She's very well respected by the other mental health providers in her community. But because of these restrictions and because of the collaborative agreement requirement, she may face closure.
And much like you stated, so many of those folks out there with the mental health issues, we don't have enough facilities. We've closed so many, and now what happens to these people with mental health issues, and they can't get care? You know, they either end up in the emergency room, or God forbid, they end up in incarcerated.
Absolutely.
And if not that, they end up in the graveyard.
Right. And none of those places are where we want to see them.
Absolutely
We want to
not.
see them in good community health centers,
Right.
in private practices where they can be managed by people who have the time and the expertise to deal with them.
And the training and the qualifications.
Absolutely.
Exactly. And to that point, too, my legislation, Senate Bill 25, would allow qualified nurse practitioners to operate independently of a doctor after having 3,600 hours and 3 years of a collaboration with a physician. So speak to me about how that sounds to you. Does it sound like a reasonable resolution for the issue?
Well, there's no evidence showing that we need that period of time, what we call transition to practice. The research that's been done on nurse practitioners has been done on nurse practitioners from the time of graduation to very experienced, and we have not shown in any of those classes that it's necessary, but we also understand that there are people who have concerns. There are people who want to make sure, if you will, that this nurse practitioner has someone in the beginning to collaborate with, to speak with, to call if there's a problem. So I think it's a reasonable compromise. Unfortunately, it's the longest transition to practice period in any legislation in the 22 states and the District of Columbia that have full practice authority currently, but we understand we have to compromise as well. So I think it's a reasonable compromise.
Right, and that was one of my other questions, was to explain, yes, this is happening in 22 other states and the District of Columbia. And to your background, the VA system now is doing it across the entire country. Is relying on certified nurse practitioners to have autonomy. And my bill would also raise the level and create like a different class of advanced practiced certified practitioners.
Right.
To that point about the VAs, do you think, Lieutenant Commander, do you think that veterans in Pennsylvania need better access to health care than they're getting now? And when a veteran goes in for an office visit, do you think that there's a difference if they see a provider who has served in the military?
Well, absolutely, there needs to be better access. In fact, President Trump recently reinstated the Veterans Choice Act, which there was some barriers that it was either 40 miles away, a local facility, or you had to have an appointment which was going to be 30 days or greater. And so he did away with those barriers, and also with this opportunity for understanding that nurse practitioners needed to practice at their educational level. This is something we had been doing in the Navy and the military for many, many years. The VA finally decided that we need to work on this backlog of unavailability of appointments, and so they decided that it was the best thing to do is to allow nurse practitioners to do this, and also a lot of the patients preferred seeing nurse practitioners generally, because we typically spend a little bit more time with them, get a little bit more involved with their families and some of their dynamics. And in regards to military experience or history and being in the military myself, there's a bond. There's just a bond that military people have among each other, no matter what service we're in, and we trust each other. And this is the same kind of trust that I do essentially see as a provider when I'm working, taking care of patients. They come in, they see you as a provider, and they understand that you're trying to do the best for them and their families. And so there's just this bond, among the nurse practitioners and the patients, and nursing as a general rule has been one of the safest and most appreciated and trusted practices in the United States for many, many years.
Last week was National Nurses Week, and once again, nurses were voted the most trusted profession in the country.
Wow.
Again.
Wonderful. Again, see? You're doing something right. You're doing a lot of things right.
Absolutely.
But again, talking about technology and moving forward and changing systems and not always relying on, well, we've always done it this way. That's not always necessarily the best way. But speaking to advancements, how about telemedicine? With the advance of telemedicine now, being able to go into rural communities and rural areas where there may not be just even your regular small town doctor, just a GP, it could be an hour away. But nurse practitioners operating and working in those communities, how do you see telemedicine feeding into the nurse practitioner system and helping to facilitate special needs of different demographics in those areas?
Well, I think it opens up a whole area of service that we have not been able to deliver to patients in a timely fashion. Nurse practitioners can be in a community, they can have a practice and function completely independently, but when they need specialty care, rather than having to negotiate transportation and financial issues and time and what have you, we can use the telemedicine practices, particularly in areas like mental health, where there's already a shortage of practitioners to facilitate and support nurse practitioner care. Other areas where we're seeing telemedicine being used is dermatology, where we can actually put on camera and send to a dermatologist somewhere a picture of a rash or a lesion to determine what's going on. We're seeing it used in surgeries. Now, nurse practitioners do not do surgeries, but we may assist in surgery, and so we're seeing it used there, and it just opens up the ability for patients to have access to care that they might not have in months and months and months in a very timely fashion.
And what you just spoke to, that nurse practitioners don't do surgery. There is a comprehensive list. There's a list of specialties that certified nurse practitioners are permitted to participate in. Can you give us the list of those specialties?
Sure. We have the neonatal, we have the pediatric nurse practitioner, both acute care, which means primarily hospital care, and primary care, which means primarily your pediatrician type outpatient care. We have the women's health nurse practitioner. We have the adult gero, meaning that you care for people over the age of 18 and as they age. We have the family nurse practitioner, which is what specialty that I have, where we care for people across the lifespan, from birth until the end of their life. And then we have the women's health nurse practitioners. And then, of course, we have the very important mental health nurse practitioners. So those populations, as we call them, are defined in the law as to what nurse practitioners can care for and be certified as.
Right, exactly. And one of the concerns that was brought up about my bill was that, well, if we get rid of the collaborations with physicians, then a nurse practitioner can just hang a shingle and act as a doctor in any field that they want to. And my argument is that's not how it works. But when you really take a look at the law, a physician who may be a urologist legally could perform heart surgery. And a lot of people don't understand that. But with my legislation just giving more autonomy to nurse practitioners, they have to stay within their specialty of certification. There is a board, a state board of nursing that sort of limits those things and watches over that. But then there's another layer of protection above and beyond that, and that's the National Board of Nursing. So there's a lot of checks and balances. There's a lot of regulation. This just allows our wonderfully trained, highly experienced, and very, very efficient nurse practitioners to work on their own without being shackled to a collaborative agreement with 2 physicians in Pennsylvania. So I really want to thank you so very, very much for all of your expertise, for all of your support in this legislation and my support for what you do. I just wanted to ask you if there's something else that you'd like to speak to the viewers about being a nurse practitioner. Go ahead.
Being a nurse practitioner is not a job. It's not a profession. It's a passion. And those of us who take the time and go through all of the schooling that is required, we start out as registered nurses. We may practice for years and years as a nurse practitioner, as a registered nurse before we go to nurse practitioner school. We don't go into this lightly. It's a difficult program. Nursing has been voted one of the most difficult programs in academia many, many years in a row. So what we do and why we do it is because we love it. It's not because we're out there trying to do something we're not trained to do or trying to prove something to someone. We're doing it because we have patients that need to be taken care of, and it's our job to do it.
I think people need to understand that we're still a member of the medical team, and no matter where we are or what we're doing, we work together for the benefit of the patient. In fact, just the other day I saved a man's life who was having a brain herniation, and I have to just tell you that there's nothing better feeling to know that at least that one day that I certainly saved one life.
Wow.
That could have almost walked out the door.
Oh my, jeez. Well, thank you for that. And I'm sure there's many, many, many stories very much like that.
Absolutely.
And the fact too that there are a lot of people in the elderly population or even in the mental health arena that just don't want to seek help, or it's too hard to get to, or it's too far away, or they don't have insurance. You know, many of these folks are on Medicaid, and there's so many physicians now that are refusing patients who have Medicaid. So where are they to go for their health care? So I believe that with the certified nurse practitioners and raising the bar just a little bit to satisfy some of those folks that are a little apprehensive, but making sure that we use this incredible army of healthcare providers who have a passion and want to do the best thing for their patients are allowed to do so. And I think that's going to benefit so many people, really hundreds of thousands of people across all of Pennsylvania who need really good health care and aren't getting it, can't afford it, or don't know where to turn. So I thank you again for being here. And it looks like that's all the time we have for today. And if anyone has any questions about this legislation or about any state government issue, I'd like to hear from you. The contact information will be displayed momentarily. Thanks again for joining me. I'm Senator Bartolotta. Thanks for watching.